Discuss about anatomy of the heart. Heart is the major organ of the circulatory system which helps to supply blood through various parts of our body. The heart is a chambered muscular organ that pumps blood received from the veins into the arteries and maintain blood flow through the entire circulatory system. The size is similar to a closed fist, and it lies in the mediastinum behind sternum between fourth and the eighth thoracic vertebra. The weight of the heart is 225 to 300 grams in adults, and the shape is mostly it has normal pyramidal shape in adults near to the age of 25 years. And this is the size of the heart with major blood vessels, and we can see the anterior view of the heart. Functions of the heart are: it helps to generate blood pressure, helps to pump blood. Mainly, it helps to separate the pulmonary as well as systemic circulation, and it helps to ensure one-way blood flow. That means it prevents the regurgitation of the blood and helps to regulate blood supply. So, by the help of contraction, it helps to force blood to various parts of the body. And the location of the heart. The human heart is located within the thoracic cavity between the lungs, and the space between the two right side as well as the left side of the lung is called mediastinum. Within the mediastinum, the heart lies in its own space, and that is called as pericardial cavity. The base of the heart is located at the level of the third costal cartilage. The slight deviation of the apex to the left is reflected in a depression, and that is the cardiac notch. Mainly, we can able to see in the medial surface of the inferior lobe of the left lung. Next, we can see the protective covering of the heart. So, the heart is covered by a fibrous pericardium, and it has two layers: visceral pericardium as well as parietal pericardium. So, visceral pericardium means the innermost layer, and the parietal pericardium is the outermost layer of the pericardium. Next, we can see the structure of the heart wall. Heart wall used to have endocardium, myocardium. So here in the particular picture, that is in this image, we can able to see pericardial cavity, then fibrous pericardium, parietal layer of the serous pericardium as well as the epicardium. Next, we can see the heart wall. So, heart wall is made up of three layers: epicardium, myocardium, as well as the endocardium. Epicardium is the visceral outermost layer, myocardium is the middle muscle layer, and the endocardium is the innermost layer, which used to have the chambers of the heart, valves, as well as the blood vessels. Next, we can see the layers of heart wall. So, the layers of the heart wall, first we can see the epicardium is the outermost layer. The term epicardium means on the heart, and this is the visceral layer of the pericardium. So, it is called a serous pericardium. Next, we can see the myocardium. This is the thick contractile middle layer of the heart, which helps to have the normal electrical connection. So while we are having the conduction system, with this help of the myocardium only, we the particular heart used to have the electrical connections. The interconnected muscle fibers help to hold the high pressured blood strongly inside the heart. In case of myocardial infarction and cardiac arrest, the myocardium will be damaged. Next, we can see the endocardium of the heart. This is the innermost layer of the heart and made up of endothelial tissues. It's also cover the beam-like projections of the myocardial tissue, and these projections are called trabeculae cornea. Inward folds are pockets formed by the endocardium, and connective tissues are called as the valves, atrioventricular valve and semilunar valves. Next, we can see the chambers of the heart. So the heart chambers, we can able to visualize four chambers. So in heart we can see right atrium, right ventricle, left atrium, as well as the left ventricle. First we can see right atrium. Two large veins deliver deoxygenated blood to the right atrium. So what are the major blood vessels means? Superior vena cava as well as the inferior vena cava. The superior vena cava carries blood from the uppermost part of the body, and the inferior vena cava brings blood from the lowermost part of the body. The right atrium which helps to pump the blood to the right ventricle. So in the right ventricle, the lower right chamber pumps the deoxygenated blood to the lungs through the pulmonary artery. The lungs reload blood with the oxygen. Next we can see the left atrium. After the lungs fill blood with oxygen, the pulmonary veins helps to carry the oxygenated blood to the left atrium. This upper chamber pumps blood to the left ventricle. So next we can see the left ventricle. Left ventricle is slightly larger than the right. It helps to pump oxygenated blood to the rest of the body. Next we can see the right atrium. So right atrium is located in the right border of the heart. It receives blood from three veins: superior vena cava, inferior vena cava, and the coronary sinus. The right wall between right atrium and the right ventricle is called tricuspid valve or right atrioventricular valve. It is made up of dense cusp of connective tissue. Next we can see the right ventricle. So the right ventricle receives blood from the right atrium through the tricuspid valve. The edges of the valve cusp are attached to caudate tendineae, and there is papillary muscles also. We can able to see the papillary muscles also. Blood flow through the valves into the pulmonary arteries via the pulmonary trunk to be oxygenated in the lungs. We can see the image of the right ventricle here. Just to see the right ventricle. So next we can see the heart valves. So heart valves used to be atrioventricular valves, semilunar valves. Right atrioventricular valve is called as tricuspid valve, and left atrioventricular valve is called as bicuspid valve. Right atrioventricular valve separates the right atrium from the right ventricle and prevents backflow into the atrium, that is regurgitation of blood into the atrium. Left atrioventricular valve is called as bicuspid valve. This separates the left atrium from the left ventricle and prevents backflow into the atrium. Next we can see the semilunar valves. Pulmonary valve, pulmonary valves and the aortic valve are called as semilunar valves. Pulmonary valve separates the right ventricle from the pulmonary arteries, and this prevents backflow after ventricular contraction. Aortic valve, this separates the left ventricle from the aorta and prevents backflow after ventricular contraction. So here in this image we can able to see the valves: pulmonary valve, tricuspid valve, as well as aortic valve